Hi, this is Dr. Paul Reifenrath for Upper Level Canine, and today we're going to talk about common orthopedic conditions in dogs. So we'll start with our juvenile orthopedic diseases, and the first one we'll discuss is canine hip dysplasia. So canine hip dysplasia is a progressive disease of the hip joint, and it leads to degeneration of the cartilage of the hip joint and eventually leads to osteoarthritis development. So this is a multifactorial disease that we see in dogs with many genetic and environmental factors being involved. Our large and giant breed dogs tend to be a little bit more at risk for this disease, but it can occur in small breed dogs as well. So breeds like our Labrador Retrievers, our German Shepherds, Golden Retrievers, Rottweilers, Newfoundland, St. Bernards, these are the dogs that seem to have a higher incidence of hip dysplasia. So early spay and neutering can be an influencing factor in some of these breeds as well. So we've discussed that with a previous talk. So also overfeeding and obesity and excessive exercise during early skeletal growth and development are risk factors. So what is hip dysplasia? So hip dysplasia occurs in the hip joint, and the hip joint is what we term a ball and socket joint. So if my right arm is the femur, the upper leg bone, my left hand is the socket or the acetabulum of the pelvic bone, typically we have a nice ball and socket joint that hip will rotate and move within that socket very smoothly. In hip dysplasia, we tend to have a very shallow socket where the head of the femur tends to move around quite a bit in that socket to varying degrees. So that can lead to degeneration of the cartilage and damage to the cartilage inside the joint. Also can cause damage, stretching and tearing of the soft tissue structures that support the hip joint. So all these changes will eventually lead to osteoarthritis with time. So basically it's early onset hip arthritis that develops because of the hip dysplasia. So hip dysplasia will also vary in severity from very mild to very severe. In our mild cases, our dogs may not show any clinical signs until osteoarthritis develops in middle age. So they can do very, very well and typically just need medical management later on in life. So in our severe cases, we'll see our 5-6-month-old puppies coming in that are having difficulty with exercise. They will run around with a bunny hopping gait with their hind limbs. They have difficulty getting up from sitting or laying down, and they're typically very painful in their back end. And they tend to have a lot of muscle atrophy, shrinkage of the muscles around the hip joint, the gluteal muscles and also the upper thigh muscles. So in severe cases of hip dysplasia, these dogs are what we call subluxating. So with the ball and socket joint, when they're walking, the head of the femur is actually popping out of the socket and then popping back in. And you can imagine how painful and debilitating that can be as they're moving around. So how do we diagnose hip dysplasia? Typically, if we see a young dog coming in with those clinical signs of decreasing exercise, having difficulty getting up from laying down, muscle atrophy in the back end, we suspect that they do have hip dysplasia. We typically recommend, after orthopedic exam, we typically recommend radiographs, and radiographs usually need to be done under sedation because positioning them for the x-rays can be very, very uncomfortable. So sedation also helps facilitate our orthopedic exam too, and we will check for laxity of the hip joint while they're sedated. So usually radiographs will show very poor coverage of the femoral head by the acetabulum or the socket, and we can see some evidence of osteoarthritis as it progresses. So how do we manage hip dysplasia? Well, there's surgical management and or medical management. So surgical management We have a couple different procedures that we do in our young dogs under 5 months of age that do not have any evidence of osteoarthritis developing. We have what's called the juvenile pubic symphysiodesis, and this is where the dog's growth plate on the pubic bone of the pelvis is destroyed with electrocautery, and this stops the growth of the pubic bone. But the rest of the pelvis continues to grow. So what happens is we tend to get increasing coverage of the femoral head as the puppy grows into maturity. And in mild to moderate cases, this can be a very effective and relatively non-invasive tool to limit the progression of osteoarthritis and hip dysplasia. So in more severe cases, we may recommend what's called triple pelvic osteotomy. And this is a more involved procedure that involves cutting the pelvic bone in 3 sections around the hip joint. And that section of bone is then rotated, and then special bone plates will attach those pieces together. And that provides better coverage over the femoral head by the acetabulum. So those are for juvenile patients. For adult patients that have varying degrees of hip dysplasia and osteoarthritis, we do have one that is fairly commonly done, especially in our small to medium-sized dogs. It's called the femoral head and neck excision. And this is where the femoral head and neck are surgically removed. So you're basically eliminating the joint and causing a false joint, and you eliminate the pain of the osteoarthritis then. So this one tends not to do very well with our large and giant breed dogs. They tend to have difficulty recovering from this surgery. So we do recommend it for dogs probably under 50, 60 pounds. For our large and giant breed dogs, and even some of the smaller dogs, we will recommend, if we have really severe osteoarthritis, we will recommend a total hip arthroplasty or a total hip replacement. And this is very similar to what humans get when they have their hip replacement surgeries, using the same type of implants. So basically the femoral head and neck are removed, and the socket or the acetabulum is removed and replaced with an artificial joint. So outcomes can be very good with this, returning the dog to near normal function without any pain. There are some potential complications with total hip replacement that orthopedic surgeons would go through a lot of detail with, but can be a very expensive surgery to go through as well. So we also have medical management of hip dysplasia. So probably the most important aspect of medical management is weight reduction and weight management. Ideally, we would love to see these dogs at a slightly underweight body condition, and that tends to decrease the progression of osteoarthritis. So we also do low impact controlled exercise. This can help with maintaining muscle strength and maintaining mobility in the hip joints. And this would be leash walking and swimming. Swimming is especially helpful because it's a non-weight bearing exercise. So we also implement rehabilitation or physical therapy. This can also be very helpful for maintaining muscle strength, improving muscle strength, and also improving joint mobility and pain reduction. So we have drug therapy, which is very commonly used. So we have our analgesics that are really important for acute and chronic pain, like our nonsteroidal anti-inflammatories. We will also, in more severe cases, as this progresses, we will add some other drugs in conjunction with the nonsteroidals like gabapentin or amantadine. We also have a newer product that came out the last couple of years called Librela, which is a monoclonal antibody therapy. And this is an antibody that is to nerve growth factor. So it's an anti-nerve growth factor antibody. Nerve growth factor is a really important mediator in the pain pathway. So it does help with moderating the pain that dogs experience. So that's another option that we have, especially in dogs when we start to getting into the more progressive aspects of osteoarthritis and hip dysplasia. We have some of our supplements too. So fish oil therapy. Fish oil can be given by oral supplement, or it can be incorporated into our prescription orthopedic diets that we use. Oral glucosamine and chondroitin can be helpful. But a word of caution, I would recommend talking to your veterinarian about the best products that are available for glucosamine and chondroitin. Many of the over-the-counter products do not have adequate concentrations of these products in them. So talk to your veterinarian about that. We also have stem cell therapy, which is becoming more popular too. And stem cell therapy is utilizing stem cells, which are harvested from the animal's body fat, and these are processed and purified and then injected into the joint. And they can be very helpful to reestablish normal joint function, improve the quality of the joint fluid, which lubricates the joint, and decreasing inflammation. So that is another option that can be available. Also, we do cold laser therapy too, which is using near-infrared light energy to help heal body tissues. That can be an important tool in our management. One of my favorite medications that I've used for many, many years is called Adequan, which is polysulfated glycosaminoglycans, which is an injectable medication that we give in a series of injections initially, and then kind of on an as-needed basis after that. This can be a really helpful tool that is very safe to use and usually very, very well tolerated. So it improves the quality of the joint fluid, which lubricates your joints, decreases inflammation in the joint, and can help repair some of the cartilage damage that is occurring with osteoarthritis. So can we screen puppies for hip dysplasia? Yes, we can. So there's a new procedure, actually it's been around for quite a while, called PEN-HIP. This is a radiographic evaluation of dogs. Can be done in puppies as young as 16 weeks of age. And this will determine if there's any hip laxity that is present. So it can be a very effective tool to predict if a puppy is going to develop hip dysplasia. We also use PEN-HIP for our breeding animals too. So getting dogs potential breeding animals screened with PEN-HIP can help predict if they are going to pass those genes on to their puppies. So if we have a breeding animal that has a very high distraction index revealed by the PEN-HIP, then we do not recommend these dogs for breeding. So there's another screening tool that we've been used for many, many years called OFA. This is a radiographic evaluation of the hips. This typically is done after 2 years of age in potential breeding animals. It's not as sensitive as the PEN-HIP as far as predicting whether puppies of the breeding pair will develop hip dysplasia. So it is useful, but it's not as effective in predicting hip dysplasia as PEN-HIP is. So I definitely recommend exercise restriction. So in these dogs, chasing a ball, any really heavy exercise, hard playing with other dogs, those are things I would try to limit. If we have a pretty high distraction index on the PEN-HIP procedure, then we would certainly refer for orthopedic surgery to help the juvenile pubic symphysiodesis in mild to moderate cases, or a triple pelvic osteotomy for our more involved cases. But usually I don't recommend supplements right away, but I definitely recommend keeping their weight ideal and also minimizing real heavy exercise. Especially if you got a dog like a lab that really likes to play hard, that can be a problem, and it can develop into some behavioral issues because they do need to blow off their steam. Usually we have to use chewing toys and things like that to kind of divert them away from excessive activity.